Welcome to this mini lecture about expectations of practical sessions for clinical skills. So one of the problems is that we would like to do something really well, but unfortunately, just having knowledge about it doesn't always work out. For example, this beautiful cake I would love to make, but if I just follow the instructions in the book, it might actually end up looking like this. So sometimes we can follow instructions and we can end up with something that looks wonderful. But unfortunately, it needs more than just knowledge or instructions. We need to have the knowledge and instructions, but we also need to have good ingredients. And most of all, we need to practice. We need to take time seeing how these ingredients work together and how to use our skills to end up with something that looks and tastes amazing. So what has all this got to do with clinical skills? Well, for our practical classes, it's an opportunity for you to improve your skills through practice. We want you to be excellent doctors, to be the best doctors that you can. And one of the ways of doing that is not simply to read about things in books, but actually to apply your knowledge and to practice using those skills to improve them and to become really competent at them. So clinical skills, as you know, is a combination of communication skills, physical examination skills, and clinical procedures. So today I'm going to just briefly go through looking at what are the teaching methods that we use and why we use them. What are our expectations of you during your practical sessions? And actually, what are some of the details of what will happen in your practical class? So, for the methods of teaching, we teach you in a way that helps you to learn from having experiences. And this is called experiential learning. So you gain knowledge by actually having and learning from an experience. And this can be affected by what you've experienced in the past. Obviously, it can be affected by the context in which you're learning, the social interactions that take place, and whether you see the purpose of the learning to actually be relevant or not. And we hope that we can teach you to realize that actually learning, even in a simulated environment, which is not real, we understand being in the clinical skills lab is not exactly the same as being in a hospital clinic. However, it gives you an environment that is similar for you to be able to practice, to make mistakes, and to learn from those mistakes to improve for the future. And one of the things that can help us to understand this learning process through experience is Kolb's learning cycle. And this is a simplified view of how learning takes place. So firstly, you have an experience and you have to think about what actually happened. So for example, you talk to a simulated patient and you think about what happened during that time, what went well, what didn't go well, what surprised you, or what didn't you expect. After this, you analyze and reflect on what happened. And reflection means turning back, looking back, thinking about what has happened. You want to ask those questions about why and how, who did what did they do, what happened when I said this, what happened when I did that. It's thinking about your own thought processes as well. And as you spend time reflecting about what happened in this experience, you can then use that learning to make generalizations for other experiences. So then you take what happened in this experience and think, well, these are some of the principles, the concepts that I can use generally for other situations that are similar to this. So it's really identifying what you've learned, what it means for you, and making that knowledge more general so that you can use it in other situations. It can also be an opportunity to identify if you need more information. Actually, I was really stuck at this point. I didn't know what to do. I need to go and learn more. Then the final step in Kolb's cycle is planning for the future. So you want to think, what have I learned? How can this be adapted to other situations? And how can I actually put it into practice in the future? So you want to make a plan of how you might do things differently another time. And then repeat and use this knowledge in another experience to again learn and to reflect on it, to make generalizations, to plan for the future, and repeat. So this is a 4-step diagram, but unfortunately, learning does not happen in a simple 4-stage diagram like this. And this diagram does not include the context that the learning is taking place in either. Real life is more complicated and a lot messier than this. So this is more what real life is like. You're backwards and forwards amongst all these things. So why do we teach you in this way? Why do we even use experiential teaching and learning? Well, having an experience won't increase your knowledge, but actually, as you think about it and reflect about it, it does. And the research literature has shown that actually, as you reflect on what you are learning, on your experiences, then actually objectively measured, that's through exams, and subjectively measured by your own opinions, students were found to have improved performance if they had reflected on their learning. So that's why we use experiential teaching and learning and how we use it. But what do we actually expect during practical classes? Well, we expect that you will prepare beforehand. Firstly, you need to find and watch the lectures and read the material that's relevant before coming to your session. So that means accessing them either on Moodle or on Microsoft Teams and looking at the material, attending virtually your lectures so that you know what's going to be talked about, so that you come prepared. We want you to think of questions beforehand. What wasn't clear and you want to ask the tutor about? Is there something you didn't agree on and you want to question it? We want you to read the scenarios, to read the steps for physical examination and clinical procedures, so that you come knowing what we are planning to do. You turn up prepared, knowing that there is going to be a communication skills session about a patient with abdominal pain. Or you come knowing I'm expected today to perform a knee examination, and I've looked at the steps. Maybe I haven't learned everything, but I know what the steps are going to be. So you have actually read the scenarios and then plan your action steps of what you're going to do. Maybe for communication skills, you come ready, thinking about what questions you're going to ask the patient, what skills you're going to use during that consultation. You come prepared knowing the steps for performing certain tests or procedures. We also want you to come prepared wearing a white lab coat if it's in person. Obviously, if we're online, you don't need to. But if we are in the clinical skills labs or other laboratories on campus at the university, you need to come wearing a white lab coat. For third years, we also recommend that you, by that point, buy stethoscopes for yourselves. Even from first year, it can be helpful to have your own good stethoscope. You will need it as you become doctors. You need to look and find out where your class is located. If it's either on campus, which laboratory you will be in at what time, or if it's online, what time will the session start? And you need to make sure you are there 5 minutes before the session. Be there before the time, ready to participate. Please make sure you see which group you are in. So different groups will be taking different classes at different times. Make sure you know your group. Are you in group A1? Are you in group D3? Stay with your group. You are not allowed to change groups. It makes it very complicated for us when we're trying to organize 400 students. So please stay in your group, attend with your group, know where your group is going to be located and at what time. We usually teach for 1 hour on one subject, and then you usually change location and you're taught for 1 hour on another subject. So again, please make sure you transfer quickly between the laboratories if it's in person and you're ready to start your next session. So for communication skills sessions, what will actually happen? Well, firstly, we want you to have read, as we said, the scenarios, attended the lectures so that you come prepared, ready to begin the session. We will take the registration, have about 5 minutes to brainstorm anything that we need, particularly for that scenario. And then we want to begin the scenarios. So we want within 1 hour to have at least 3 sections where we can have you participating and performing in role plays. So role play is an opportunity for you to pretend to be a real doctor, but it's within the safety, as we say, of an experiential opportunity that's in a simulated environment. So somebody will be the simulated patient and one of you will be the doctor. You can at any point say, I want a timeout. So a timeout means you can stop the scenario. You can turn to your other students, your colleagues, and ask for help. You can say, I don't know what to ask next. I'm really confused. What should I do? Oh, I didn't expect the patient to stay there. What should I do now? So use a timeout for your colleagues to be able to help you, to give suggestions, and then you get back into the role of being the doctor and you continue that scenario. So you continue asking questions to find out what is wrong with them. We want you to be practicing not only your knowledge, but also your skills. The things that you have learned from first through to third year, we expect you to keep on practicing those skills. After one person has done the role play, we will then ask for feedback. So the person themselves can say what they thought went well, what they would like to actually improve on. We will invite the patient, the simulated patient, to give feedback. How did they feel as a patient the consultation went? We want to ask you as students who are watching the consultation to also give feedback, and the tutors themselves can give feedback. The aim of giving feedback is so that you can learn. So to say, actually, these things went well, these things could be worked on, these things could be done in a different way. As we said from Kolb's learning cycle, learning what maybe wasn't so good so that you can practice next time on using that skill or asking things in a certain way. We then want to give you an opportunity to practice. So if it's possible, we will break into small groups with one person being the simulated patient, one person being the doctor, and one person observing and watching for those skills and that knowledge being demonstrated. Or if it's not possible to break into small groups, we might get you to do small groups within the lab, or again repeat with another student in front of the whole group. Again, they can do the role play, receive feedback, repeat. And then at the end of the session, we'll reflect on the learning points that have been learnt during the session and any preparation for the future. So that's how communication sessions will take place. For physical examination sessions or clinical procedures, Again, firstly, we will register you and check if there's any questions. Then we will go through with a quick demonstration by the tutor of the steps. So for example, for blood pressure, we will go through demonstrating how to measure somebody's blood pressure. At this point, for example, with clinical procedures or with physical examination, we do not want to go into every single detail about every sign or how or why we are doing things. We will expect you to have watched the lectures and to have learnt that knowledge. Then we want you to have an opportunity to practice in small groups. So at this point, in small groups, you will practice either examining a patient or doing a clinical procedure. Please use this time to practice. Don't just think, oh, I know it all, and walk away. This is the time when you can practice together, learn together. The tutor will come into the rooms, if in the clinical skills lab, to be able to give input. It is really important to practice. Without practice, you will not develop your skills. Then there will be opportunity for a student to demonstrate in front of the whole group how to do a physical examination or a clinical procedure, and an opportunity to reflect on the learning points. So these are some of the references from today, and as we have said, we need to have knowledge. We need to know how to do things. We need the right skills, the right ingredients, but most of all, we need to practice. And we want to give you the most opportunity to practice learning these clinical skills so that you become competent doctors. We hope that you will end up with something amazing like this cake, that actually, as you practice your skills, you will develop them to be excellent, competent doctors for the future. Thank you so much.